Good morning. So my first question will be, what the role of innovation? Why is innovation a key factor in the challenging healthcare sector?
Innovation is very key to healthcare. The reasons for innovation to be present and for all of us in healthcare to be consistently trying to innovate is because healthcare is a very dynamic industry. Consequently, we look at innovation in technology. Technology is always developing, always improving, and every day we have new technology in healthcare. But we need to look beyond the hardware of technology. We need to look at process innovation. We need to look at organizational innovation, and that is a lot more difficult. Organizations have a very tough time looking at how they're going to look within 2 years, 5 years, 10 years. And we need to be able to have an organization look at their future because their future depends on improving their present. So by improving their services, their quality, their processes, and innovating within those areas, they are going to be able to have a much better future. Today, healthcare is challenged in many ways. They're challenged within the financial constraints of a global crisis. They are challenged with new developments in technology, which is extremely costly. And they're challenged with new designs in pharmaceuticals. They're challenged with healthcare becoming a much more complex industry than it was 10, 15, or 50 years ago. So consequently, organizations have to have a platform where they can have organizational innovation so that they can survive in the future.
And innovation within quality?
Well, quality and safety for patients is paramount. An organization that is safe, that has high quality, and has results to prove that is an organization that actually has better financial outcomes because by having better quality and services, better safety, they have less complications. Complications are very costly. If you look at in the United States, 1 out of 135 patients has a hospital-acquired infection. Now, there are over 9 million admissions to the United States hospitals today, every year. Imagine if you do the math, what that means in dollars and cents, leaving aside the human cost. What is the financial cost to the healthcare environment? We're talking about hundreds of billions of dollars. So therefore, we need to have quality and safety as part of the innovation of an organization.
What is your opinion in this second seminar organized by Just the World?
Well, I think it was great. I wasn't part of the first one, but this second one was absolutely excellent. I think the people that came here, I learned so much from them. A great mix of industry, of government, of hospitals. I think it was a wonderful mix of professionals and key leaders, key opinion leaders that were able to not just focus on the questions that we have, but one of the things that we need to come out of this meeting of this type is the solutions. What solutions can we give to the healthcare environment? And we're talking about a global healthcare environment. We're not just talking about Europe or the United States, but really looking at globally, what can we take from this meeting so that we can implement solutions for the entire healthcare environment?